Okay, let's dive right into this. Welcome to today's Explainer, where we're unpacking one of the most intense, high-pressure roles in the tech industry today, which is delivery management in the medical device sector. We're drawing from some fantastic source material to outline exactly what it takes for a senior delivery manager, someone who probably brings over 16 years of experience in IT, managing everything from agile transformations to AI-enabled software, to really succeed here. Because in this environment, standard rules just don't apply. We're going to explore exactly how they balance intense commercial pressures with absolute clinical responsibility.
So, I want you to imagine for a second that you're leading a massive cross-functional software delivery team. Now, in standard IT, a bug might mean a crashed app or maybe a frustrated user, right? It's annoying, for sure, but usually it's fixable with a quick patch. But in the medical device domain, no way. A bug isn't just an inconvenience, it's a potential risk to a human life. And as the source material perfectly states, delivery success here isn't just about hitting a date or staying under budget. Quality and patient safety are equally important. The stakes are just fundamentally different.
To make sense of all this, we'll follow a pretty straightforward roadmap today. We'll start with the high-stakes delivery manager, look at a structured operating model, dive into the metrics that actually matter, tackle a couple of really tough crisis scenarios, and then wrap it all up with the golden rule.
All right, part one, the high-stakes delivery manager, and that constant, intense tug-of-war between commercial pressure and clinical responsibility. Look, software is no longer just the system that runs the hospital billing department. Software itself is now a clinical tool. We're dealing with SAMD, that's software as a medical device, which includes things like diagnostic AI. We're also dealing with IoMT, the Internet of Medical Things, so connected wearables and remote patient monitors. And for a delivery manager, this means every single line of code, every connectivity protocol, and every data exchange has to be wrapped in strict compliance frameworks. We're talking FDA regulations, the European MDR, ISO 13485 for quality, and IEC 2304. You have to embed these regulations throughout the entire product lifecycle, coordinating your engineering, QA, and regulatory teams flawlessly.
Now, this contrast is actually super helpful. In standard IT delivery, your primary obsessions are usually velocity, budget, and hitting milestones, right? Basically, how fast are we shipping and are we under budget? But in medical device IT, while you definitely still care about those things, your absolute baseline is validation, requirements traceability, and rigorous FDA or ISO compliance. Standard IT metrics alone are totally insufficient here. I mean, you could be perfectly on time and well under budget, but if your traceability matrix is incomplete, your product cannot legally or safely go to market.
So, how in the world does one person manage all these engineering and QA teams without losing their mind? Well, that brings us to Section 2, a structured operating model.
You don't manage a massive program through direct, individual micromanagement. You build a machine. First, you establish the exact scope, objectives, and governance. Next, you define very clear work streams and ownership. Step 3 is creating your RAID mechanisms. So that's tracking risks, assumptions, issues, and dependencies. Remember, a risk is a future event, but an issue, that requires immediate action. Then you define your KPIs and SLA measures, and finally, you conduct regular health checks to apply corrective actions. It's all about a consistent delivery rhythm.
Now pay really close attention here, because this is the #1 trap programs fall into. Quality, validation, regulatory, and documentation activities absolutely must be integrated from the very beginning of the delivery plan. They are not a final checkpoint. You cannot treat compliance as some testing phase you just tack on to the end of a sprint. If you wait until the software is built to start figuring out your ISO documentation, you've already failed. It has to be in the DNA of the daily work.
And to keep that level of rigorous control, you need the right data. Let's move to Section 3, metrics that actually matter, looking way beyond just velocity and cost.
A senior delivery leader tracks program health across 5 main categories. You've got delivery metrics, checking things like lead time and predictability. Quality metrics, looking at defect leakage and rework. Operations, to ensure SLA adherence. People metrics, closely watching team capacity, utilization, and attrition. And business metrics, tracking budget variance, margin, and customer satisfaction. This is your standard baseline dashboard to keep a complex program financially and operationally healthy.
But what separates a standard manager from a medical device expert? Well, if you're delivering SAMD, you have to layer these specific compliance metrics right over your dashboard. You're actively tracking the validation status of every single feature.
You're monitoring requirements traceability to make sure every line of code actually ties back to a verified patient need. You're watching nonconformances, audit observations, and CAPA, that's corrective and preventive actions. Change control adherence isn't just bureaucratic red tape here, guys. It is quite literally the vital heartbeat of your regulatory standing.
Okay, let's put all this theory into practice. Section 4 is our first crisis scenario, the delayed release. I want to put you in the hot seat for a minute.
So, you're managing a massive program. Millions of dollars are on the line. The commercial team is breathing down your neck, demanding the release. But validation testing on the new software is incomplete. The question is, do you push the release to meet the schedule? The business really wants that revenue. What do you do?
The expert response here is completely methodical and firm. First off, you absolutely do not push the release simply to meet the original schedule. Patient safety is on the line. Instead, you follow these steps. 1. Understand the exact validation gap. 2. Perform a formal safety and compliance impact analysis with your engineering, QA, regulatory, and product teams. 3. You create concrete recovery options, maybe adding validation capacity, doing parallel execution, or prioritizing a smaller scope. And 4. Present those options to obtain the appropriate approval. You give leadership data-driven choices, not a panic attack.
But what happens when that kind of schedule pressure boils over into relationship issues? Let's check out Section 5, our second scenario, the unhappy customer.
Let's say a phase of your program goes off the rails. Deadlines are blown, and the customer is furious with your delivery performance. Now, human nature makes us want to jump in and immediately defend our team, right? To explain away the issues. But how do you handle this transparently instead of defensively?
Well, the very first thing you do is stop talking and just listen carefully. You have to establish facts over feelings. Analyze the core pain points objectively. Are they upset about missed commitments? Are there actual quality issues, communication gaps? Maybe there are resource constraints or scope changes that got out of hand. You map these out logically so you understand exactly where the delivery engine is breaking down.
Once you have the facts, you build a totally transparent recovery plan. Step 1, root cause analysis. Show the customer you actually know why it broke. Step 2, put corrective actions in place with clear, named ownership. Step 3, present revised, realistic milestones. Never promise a date you can't hit, just to make them happy in the moment. And Step 4, establish a rigorous weekly governance rhythm. You rebuild that trust through predictable execution. You personally increase executive communication until their confidence is entirely restored.
Which brings us to our final section, the ultimate climax of everything we've talked about today, the golden rule of medical device delivery.
If you take literally only one thing away from this explainer, let it be this unshakable principle from the source material. Never trade patient safety or regulatory compliance for schedule pressure. It doesn't matter if the program is $10 million over budget. It doesn't matter if the release is 6 months behind. Commercial urgency can never, ever override your regulatory obligations or the safety of the patients who rely on your product. Your job is to optimize efficiency and manage risks, sure, but never at the expense of human life.
Navigating this highly regulated space takes immense discipline. It requires integrating complex engineering, QA, and strict compliance into one single seamless heartbeat. So as you think about your own projects and your own management style, I'll leave you with this question. Will you build compliance into your delivery lifecycle from day one, or will you risk everything by treating it as a final checkpoint? The choice you make defines not just the success of your software, but the safety of those who depend on it. Thanks for joining me for this explainer, and keep building with purpose.